Today, we're going to talk about 3 ways women can reduce their risk of stress and stroke. So joining me today to discuss the link between chronic stress, high blood pressure, and stroke is 2022 American Heart Association Physician of the Year. Congratulations, by the way, Dr. Jennifer Mieres. Thanks for joining us.
Thank you. A pleasure to be here.
Chronic stress and stroke, how is that related?
So I think this is a timely conversation. The American Heart Association, American Stroke Association, as we celebrate Women's Health Month, want women to know the evidence that links chronic stress to an increased risk of stroke. We know now that chronic stress, we can't avoid it, but it has a high link with high blood pressure, hypertension, and that women who have hypertension, stress related, are at increased risk of having stroke as well as heart disease.
Are there some stroke risk factors that are unique to women?
We know now that women who have had pregnancy-related complications of high blood pressure, gestational hypertension, gestational diabetes, eclampsia, preeclampsia, blood clots during pregnancy have a significantly higher risk, short-term and long-term, of developing stroke.
Are these risks the same, though, for all women?
We know that each woman is unique, but the evidence shows us, and we look back over the past few years, that African-American and Black women have a much higher prevalence of pregnancy-related complications, such as preeclampsia, diabetes, hypertension, and therefore much higher burden and chances of having stroke post-pregnancy. And so higher risk for heart disease and stroke in African-American women that had pregnancy-related complications.
All right, we promised them the 3 things that we can do to reduce our risk. What are they?
And the good news, the American Heart Association and Stroke Association would like to know that most strokes can be prevented. Knowledge is definitely power. And so we want women to know that even taking 10 minutes a day to decompress, to reduce chronic stress, can definitely have a profound impact on decreasing your blood pressure. So 10 minutes a day, put yourself on the calendar for some me time, meditate, yoga, go for a walk, go for a swim, jog. I always like to say 10 minutes of laughter will definitely do the trick in reducing your blood pressure. Secondly, we want women to be empowered and take charge to know their heart healthy numbers. Know your blood pressure, your blood sugar, your cholesterol, know your body mass index. And importantly, make a logbook, take a logbook with these numbers and discuss your risk of heart disease and stroke when you see your doctor, because the good news, heart disease and stroke can be prevented with simple lifestyle changes. Sometimes you will probably have to take medication, but small lifestyle steps can reduce your risk significantly of having a stroke.
Well, thank you so much for joining us today. But if we want to learn a little bit more, where do we head?
Go to the Go Red for Women website on the American Heart Association's website, as well as stroke.org, to learn a lot more information about women, how to prevent heart disease, how to control for stroke, how to prevent a stroke, but also importantly, to get additional information about research that's going on to understand the unique aspects of heart disease and stroke in women.
Well, thank you again, Doctor, for helping us stay healthy.
Thank you very much. A pleasure being here.
And if you'd like to see this segment again, just head to our website, firstcoastliving.net.